I want to take this a step further,
Sure.
and I want you to comment on this when I get through. But basically, it's the how and why and when of introducing a patient to this new, different modality than what they had before. In other words, do you discuss this with them before the symptoms appear, as they're really emerging into presbyopia, or do you wait until their symptoms appear before you discuss this? Do you prepare them in advance, or do you basically wait until everything it comes out? Should we be proactive or reactive? And I think I'd like you to just comment on that first.
Yeah,
We'll take it
absolutely being proactive. I mean, our patients are coming to us for the best treatment that's out there. And I think we're all comfortable in the eye care world of prescribing spectacle glasses to our patients for their computer use. I mean, I do it on an everyday basis to my spectacle wearers. A separate pair of glasses for their computer and for their distance and their sunglasses. Nearly everybody walks out with 3 pairs of glasses, whether they're 45 or whether they're 35. And it's all dependent upon, of course, what the patient does. But those patients that are on the computer all day, we ask, how do your eyes feel at the end of the day? So we start moving those patients early on, and we discuss with them. You're sitting at a computer all day. If you were playing basketball all day, you wouldn't be having 1 pair of shoes. And we need to have you have a pair of contact lenses that are specific for the activities that you're doing all day. And these contact lenses reduce the amount of effort that you have to put in at your computer distance. And the patients get it. They don't think, oh no, I'm getting old, I have to go into bifocals like my mom or dad. The patients realize, oh, my doctor sees that I spend 8 hours at the computer and then 5 hours at home on the computer. He's prescribing glasses or contact lenses for me specific for those activities. And when you get specific prescribing, when you're doing specific activity prescribing, patients get it and they see a value in it.
Your practice ages with you. And that's all of a sudden my practice are a whole bunch of emerging presbyopes.
Speak for yourself.
Jack's practice is a bunch of 20-somethings. But your practice does age with you, and so you get it as you kind of go through your practice. I tell my patients it's not that you're getting old, it's a little bit of a birthday issue. We need to work on these things. But some clues to whether they're having problems are going to be your comfortable wearing time. Are they decreasing their comfortable wearing time during the day? What they're doing when they're, during the day, all day long. All of those are nonverbal clues that they sometimes can give you if they're sitting in the room holding their iPhone or things like that. All of that will lead to whether you need to have that discussion earlier. But I think it's important to bring it up even before they are actually having the problem. The other thing is your patients can give you clues. It's not necessarily about vision. They might be able to see clearly, but are they comfortable? And asking comfort issues, not just about eye strain, but, does the back of your neck hurt?
Absolutely.
Does your shoulders hurt? Other body aches that they may have actually may point to the fact that they are having some vision issues. Maybe how they're holding their posture, they're leaning in or they're sitting back, they're not ergonomic while they're on the computer, and that actually may be a vision problem. And so asking those questions can help lead to whether you need correction.
Can I ask a question? Oh, go ahead. I'm sorry.
So what you're really saying here is you're planting the seed at that point as well. It's not just...
I call it looking in my crystal ball. I will look in my crystal ball to the patient when they're 35, 36 and say, hey, look, I'm already blah, blah, blah. What you're going to notice over the next couple of years is this is going to happen, that's going to happen. Don't worry. There are plenty of options for you when those things happen. You're not going to stop wearing contacts. You're not going to start having a line on your glasses. There's plenty of ways that we'll be solving that. It'll be moving you into newer and better technologies. And so even if that patient is not being fit today, they know that there is something that I'm going to talk about when, I'm like, do you notice this now? Computer strain to set. No. Okay, the day that you start to really notice that, I've got options for you. We'll talk about it.